Helping Seniors Television, all about improving quality of life for seniors. If you're a senior, know a senior, or plan to be a senior, then this show is for you. It's all about helping you develop your own aging plan so you can age actively and with dignity. Helping Seniors Television from the Helping Seniors Network of information, education, and resources.
Hi, I'm Kerry Fink with Helping Seniors of Brevard Television. What a pleasure it is to have you with us today. I have the privilege of sitting in for our president and founder, Joe Steckler, and we're going to be talking all about helping seniors today. As you may know, Helping Seniors is Brevard County's senior information helpline, and I'm going to give you that phone number right now, so grab a piece of paper and a pencil and let's jot down this phone number, 321-473-7770. 321-473-7770. And here at Helping Seniors of Brevard, we take calls from folks all over the county and oftentimes all over the nation. And what we try to do is do our best to provide information that will help somebody develop their own aging plan. Our president and founder, Joe Steckler, has always talked about the need for understanding elements of care and creating our own personalized, individualized aging plan. You know, as we go through life, if you're going to school as a young kid or young person growing up, the whole time they're saying, well, what's your plan for your career? Do you need to go to this college? Do you need to get these kind of skills together? So that you make a plan for what you want to do with your career. And then as we get into our careers, they say, well, what is your plan as you go along here? How are you going to take care of your family? Do you have kids that you might want to plan for college? Are you planning for your own retirement and all that? And then when we get to our golden years, the question is, they say, well, what's your plan for retirement? And most of us come up short. We might have thought about a financial plan, but did we think about the plans that we need that will help us feel good and do the best we can as we continue to age? And that's what Joe Steckler has always talked about as it pertains to helping seniors. We need to help people think about that and create their own aging plan. So today we're going to tackle a topic that is always of interest. In fact, if we go through the TV programs that are archived in all of our television programs, more than 250 are archived now on the Helping Seniors YouTube channel and the Helping Seniors website. Let me give you that website, helpingseniorsofbrevard.org. That is helpingseniorsofbrevard.org. And of those 250 different programs, 250 plus programs that are listed there, one of the top viewed program categories is actually pain and pain relief, because as we age, we run into more and more challenges with feeling good. And so one of the questions, besides getting the doctor to write one more prescription on his or her prescription pad, there may be a need to take a look at and think about some things that go beyond maybe traditional medicine. That whole side of things is called the holistic approach to medicine, and we're honored to have in the studio today an opportunity to talk with Dr. Kevin Kilday, who operates the Holistic Health Center and has partnered with the Helping Seniors Network. So welcome to the show today.
Well, thank you for having me.
And what we're going to talk into, maybe as just a place to kind of jump into this, we talked about asking you to look up some current statistics about chronic pain, who it affects, types, disability, how many people suffer. Because I would presume from the statistic that I anecdotally reported, which is how many people and how popular programs that we create about pain management are for our viewers, that it has to be a pretty pervasive issue.
Well, yes, it is. You know, according to the statistics, in America, there is 50 million people affected by chronic pain.
Wow.
And it's the leading cause of long-term disability in this country.
Wow. That is a lot of folks. Now, folks, if you're familiar with Brevard County, we often tell people that if you're in Brevard County, you need to understand 1 out of 4 people is over the age of 65. And in Brevard County, 1 out of 2 people, 50% of us, are over the age of 50, which, as you know, in AARP world, they say, well, that's a senior. Mm-hmm. So Do you have any demographic breakdown about how it works with pain, like who reports? I would guess that we'd probably find senior Americans probably really overrepresented in that 50 million.
Well, yes. One surprising statistic to me was 70% of those affected by chronic pain are women.
Wow.
And I didn't think, I thought, I knew the number was, was somewhere. I thought it was around 50-50, but it looks like, it's 70% of chronic pain are suffered by women.
It's funny when we talk about that because we talk about things, there's a disease called fibromyalgia as an example that you'll hear Joe Steckler talk about on radio and TV shows that he's been diagnosed with that. And that's one of those things that just leaves chronic pain in the mix for you. And I guess it's one thing if you got an injury and it hurts, you feel like, well, there's an opportunity that over time this is going to get better. But if you're living with chronic pain, I guess one of the things it does is it diminishes your hope because, like, you must feel like, how do I get out of this?
Yes, I mean, it's, you can also suffer from, some mental health issues too, dealing with chronic pain on a daily basis. They find a lot of people, because of chronic pain, it means going on every day, and severe, they may suffer from depression, or they may suffer from anxiety, just overall, poor health because they start to lose, interest in life, or they're concerned that, with this much pain, I mean, how long can I live like this?
Well, and then there's almost a flip side to that because you have a tremendous background in addiction recovery and things like that. You've helped a lot of people, and that's another thing that you do through the Holistic Health Center. But, isn't some of that people turning to things that they shouldn't turn to, maybe in an effort to kind of self-medicate? And I don't know if we hear about the opioid crisis. We certainly know about alcohol abuse and things like that.
Right. Well, my personal opinion from working, and it's also been documented, from working with, a lot of addicts, especially opioid addictions and heroin.
Mm-hmm.
The root cause of these addictions actually started out with pain. Mm-hmm. A lot of these people addicted to opioids had went to the their primary care doctor or their workman's comp doctor, whatever, and not so much today, but as of a few years back, I mean, the doctors were giving out the opioid medicines quite a bit, and just constantly refilling them if the patient calls and he's still in pain. Mm-hmm. But nowadays they don't do that. I mean, even if you go to the ER, I believe they only give you about 3 days worth of medicine, and they tell you to follow up with your primary doctor, and then they can discuss it further then. But even so that would be the root cause, I believe, is a cause of a lot of these opioid addictions, because it's a highly addictive drug, like oxycodone and hydrocodone and Percocet and Loratab and all of them. They're very highly addictive.
And then we've talked about this before. I know Joe has talked about this on radio shows before, that it becomes very difficult because now when you go to a doctor, because I understand why they want all these things, but it's a little bit unfair to the senior citizens who may be suffering from pain, that now they have to jump through a lot of extra hoops they have to get to the doctor more frequently and try to manage that aspect of pain. And then on top of that, now you're almost treated like a criminal because you're in pain and you legitimately need some help with this stuff. And I guess that's maybe where we turn the page when we start to talk about alternatives to those kind of things, because that's really what you're about with Holistic Health Center.
Yes, that's right. There are alternatives, for pain in
Mm-hmm.
particular. But just jumping back a little bit to addictions, I do have a a holistic natural protocol on my website for anybody who is addicted to opioid drugs or really any drug at all. I mean, even alcohol or marijuana, whatever the case may be. If they went to my website, holistichealthcenter.us, there's a program on there called Holistic Addictions Therapy.
So that's a good place to go. Say that website one more time.
Yeah, holistichealthcenter.us.
Okay.
And then just go to the bottom of the opening page, and there's a section there called Holistic Addictions Therapy.
Okay.
And that's a whole program in itself. But inclusive in my program would be if an addicted client had come and seen me and they are still in pain, they are just going to need something, not from an addictive point of view, but just need something, maybe over-the-counter aspirin or Advil or whatever, which those are okay, but really they're not really good for long-term use. So we can sub, some natural products, such as herbs that have been around for 5,000 years in China and in India. So there are numerous ones here. I have some, and they're all backed up by clinical studies.
Well, that's what I was going to ask. Isn't that a lot of times why people are maybe a little bit skeptical at first about this, is because we see an ad on TV, if you just take this supplement, all your pain will go away, or something like that. And then if you ask your doctor about it, the doctor may want to be sympathetic to the idea, but then he's concerned, well, what is actually in the medication, or not medication, I guess that would be the wrong word, but what is actually in the herb? Has it been studied? What's going on? Right.
Well, unfortunately, the doctors don't even go that far with you. They may just say, well, a lot of doctors just say, well, I don't know anything about herbs. Because, they're just not trained in it.
But from
they don't want to say anything
that
would, that the patient might take out of perspective, So,
but from your perspective, having studied, tell us a little bit about what that means when you say herbs and things that you might take for pain.
Right. Well, there's one called Boswellia, for instance, which is actually a compound in frankincense.
Oh, wow.
All right. It's been used, for thousands of years in India, and the clinical studies have shown that the joint pain has been reduced from 32 to 65%.
Wow.
As compared to prescription medications, and there's no there's no side effects from it. I mean, there are supplements out there that that may have some supplements, but anything that I recommend, I always make them aware of that. I always find out if they're taking any medication. I always do an interaction check to make sure there's no interaction with some present medication that they may be taking for something else.
Right, right.
But there's also, I mean, the more popular one today would be CBD.
Sure.
That's why a lot of people are going for that. It has been studied a lot, and it helps with slowing down the intensity of pain and getting you to relax more. It's a very good relaxant. It helps you sleep better if you're in chronic pain. It also reduces inflammation, and there hasn't been any side effects that they have found so far.
Well, and that's a question I want to ask you, because we hear a lot about every place you can go. It seems like you can go into a convenience store today and buy, quote, CBD oil. But as you have explained to us before, that's not necessarily the same thing as what you would consider like medical grade or something like that. And explain a little bit about where you get your herbs and supplements and things are so important.
Right. Well, when I was entertaining the idea of bringing on CBD, in my practice, I was approached by a lot of manufacturers, and I went with this one particular company because they offered, a medical grade, and they guaranteed that it was medical grade.
Okay.
So I believe it's, it's superior to, the stuff that you may buy on, at the local grocery stores or corner stores, the vape stores or anything like that, because the company I represent have certificates of analysis available on demand. You just got to go on their website and type in the info off the bottle, and it gives you a complete certificate of analysis right away, on the product.
See, that's an interesting thing because my wife has a doctor friend up from when we were in New York City, and she stays in good communication with her up there. And one of the things that's interesting, she's a medical doctor who sees patients traditionally, but also really believes in the holistic approach, probably more so. But she always explains that the challenge that most physicians have with holistic alternatives is they're always looking for those clinical studies. They're always wanting to know that the batch that you get tomorrow is the same as the batch you would get yesterday. And so they're always concerned about those levels of consistency. But what I hear you saying is that that's a thing that you take into account when you decide which brands you recommend and things like that.
Right. So my product is totally sourceable also. It is made in the United States. There's some CBDs out there that are actually made overseas, with no quality control whatsoever. Our product is made in Kentucky, grown in Kentucky, and bottled and right here in Florida. And it's a very good product, and the price is very competitive. It will be about the same as some product that you will buy in a vape shop.
So let me ask this question. Let's just talk for a moment, because I know one of the things that you're really interested in doing is sitting down with people, learning their particulars, and then working with them to come up with a plan that is effective given their particular constraints. But at the same time, you have products that are available that people can call and order. How do they get in touch with you if they're looking to maybe take advantage of one of these kind of products, or they're interested in at least learning more about it?
Well, you can call the office at 321-549-0711, and I personally and most times answer the phone.
Okay, say that number one more time.
321-549-0711.
And also, I think now too, you were explaining you have some products that either are available already online or going to be, and that they can get to you at your holistichealthcenter.us, right?
Correct. There was a product I just took on, recently that I'm very, very impressed with. And it's called, Cure It.
How do you spell that?
Yeah, I was just going to say it's called Cure It with a K. It's Kure -IT, because we don't want to say anything about curing anything. It's just the name of the product. But it does help to relieve a lot of health issues. And it's called the RX series. We have one we call an RX1, which is for mild to moderate pain, but there is numerous things that it helps with. I mean, it helps with pain, with arthritis, with inflammation, as well as torn ligaments and really anything that's painful that has happened to you, in your body, sciatica, carpal tunnel, gout, and there's different. The blends have all the same products. There's actually 13 infused oils in it, and they consist of like frankincense and myrrh, basil, rosemary, oregano, tea tree, cinnamon, spikenard. Like I said, there's 13 of them in there, and many people have tried this, and there's even testimonies on my website.
Okay.
I have a client right now that's suffering, from MS and is in a lot of pain all the time, and and she's buying one of the strongest ones. But she says, Kevin, this is one of the only things that has stopped my, my chronic pain.
You know, it's interesting because I noticed here in our notes we said it's a blend of biblical herbs in oil form, and that's really the issue is that there are things people sometimes get confused because we've even had this conversation before that many of the prescriptions and the things that we are given, they all come from or many of them come from things that you find in the earth.
Right. Yes, a lot of medicines today that most people don't realize, have been, reinvented by the pharmaceutical industry, meaning they just, tweak the molecules a little bit and still get the same results. But a lot of them have been, herbs.
Right.
And plants and just oils and just everything has been around for as long as these herbs have.
So here's a question too, because I think when we talk about pain and all that, I hear a lot of times at the same in sort of the same sentence, there's something about a compromised immune system and things. I don't know, maybe the body is using a lot of resources to fight the pain, or just other things may be going on. So I want to get into this topic in for a couple of minutes. We were talking about when it comes down to like flu and cold season, or people get nervous about viruses. Am I going to catch something from somebody else or something going on? How does all that stuff interrelated, and how do how does holistic health care approach those items?
Well, as with pain, there are a lot of clinical studies out there of herbs that have shown great results for for colds and and flus, and just to name a few that have some good positive clinical studies. Of course, you have the most popular one, which is vitamin C.
Sure.
High doses. I'm talking about high doses like. But you got to be careful with vitamin C, because you start taking high doses above like 3 grams or 3,000 milligrams, it could cause some stomach upset or even some some bowel loose bowels. Okay, so you just got to be careful with that. But research shows that high dose of vitamin C reduced flu symptoms by up to 85%.
Wow.
Compared to over-the-counter pain relievers, and decongestants. Plus, it also increases and strengthens the immunity system.
Right.
You have another one. A lot of people have heard of this. Is echinacea, which is an herb. And a double-blind study in Germany has shown that infections with flu-like symptoms, the fever, the body aches, the coughing, cleared more rapidly by stimulating the immune system. So it's another immune builder.
Okay.
So that's one of the key things of preventing colds and cold is really a virus.
Right.
It's just a very they really haven't come out with let's say a cure for the common cold yet, but because it's different types of viruses and stuff. So I don't know what their reason is, but a lot of people complain. Well, they got so much technology today and medicines today, but they don't have anything to cure the common cold.
Yeah, we hear that all the time.
But as far as we're in the middle of the flu season. Also, another common vitamin like vitamin D, for instance, which is which is a very good idea when you do your annual physical now, to have your doctor. You just have to ask them, and it's minimal cost, just a few dollars, to have your vitamin D level checked, because most people don't realize it, and the doctors are starting to see now. Some doctors are even making it part of an annual physical, without the patient having to ask, because it's very important. They did a study one time of people with cancer, all right? Over 50% of the people they tested with cancer were deficient in vitamin D.
It's interesting. I was going to say that in our own family, I know several people who the doctor was prescribing supplemental vitamin D just because of that.
Right.
Well, let me ask this question, because we're really down to about a minute left in the show. So I wanted to just kind of tag up and say, there's so much to this that all we can ever do in a show like this is hit a 30,000-foot overview. But I really want to encourage you, viewer, to get more information. Get in touch, whether you go online at holistichealthcenter.us, or let's give that phone number again to get in touch with Dr. Kevin Kilday of the Holistic Health Center.
Yes, people can call me at 321-549-0711. I'll be more than happy to discuss these supplements that are good for pain, and then are also showing positive results for reducing the severity of colds and flu. I'll be more than happy to discuss them on the phone, because I only it was only the tip of the iceberg what we discussed here. There's actually over a dozen pain relievers, natural ones, and over a dozen supplements to reduce cold and flu symptoms.
Well, thanks, Dr. Kevin, for being with us today, and thanks, viewer, for being with us. I'm Kerry Fink for Helping Seniors.
Stackler, thank you for joining our program today. I'd like to remind you that our senior information line is available to you at 321-473-7770. There you can get help and direction that could be helpful for your specific situation or circumstances. The work of helping seniors is very important, but we can't do it alone. That is why our sponsors here in Brevard County are so important. I'd like to thank our many area sponsors, businesses and medical providers who support the mission of helping seniors that help us carry the cost of our media efforts. If you'd like to join us either as a business partner or simply donate as an individual, we would welcome your call at 321-473-7770. You are always welcome to visit our website at www.helpingseniorsofbrevard.org. Thanks so much for your help. It does make a difference.